With a premium IOL patient, there's really no room for error. You've got the specific lens that the vast majority of the time has to go in the capsular bag, and it has to be in a precise position, right? The effective lens position of the IOL in the eye is going to change its focus. So to ensure that, you really need to have a very accurate and consistent capsulorhexis or capsulotomy, because that's going to hold the lens in place. So you can't even start in the premium channel unless you've already mastered a beautiful 100% consistent capsulorhexis, or using another device like a ZEPTOLink or femtosecond laser to make a perfect capsulotomy. The big variability in doing a lens calculation is the effective lens position. Where does that IOL sit in the eye, front to back? And as we know, a movement of a millimeter makes a huge difference. So to help achieve that predictability and accuracy and long-term stability, we need to have a very consistent capsular opening. Now, we know in our IOLs, the optic is 6 millimeters in diameter, so we want somewhere between a 5 to 5.5 millimeter capsulotomy that's well-centered so that can hold the lens in place. You'll get a 360-degree overlap of the edge of the capsule on top of the edge of the 6 millimeter optic. And that's going to give you that great predictability for the refractive outcome and also the long-term stability of that IOL. And that, of course, gives patients their best visions, and also all we want is to make our patients happy. ZEPTOLink is amazing for difficult or complicated cases. Like on our Cataract Coach website, I featured cases of a intumescent white cataract. You know, that fluid-filled white cataract, as soon as you start to poke in and try to do a manual capsulorhexis, what do you get? Zipping out to the periphery, the Argentinian flag sign, a bad complication. Well, how do you prevent that? I like to use the ZEPTOLink to make that very precise, centered, and then safe capsular opening. You can make it in 4 milliseconds. So obviously much faster than any other device, and it's super consistent. So in a case like that of an intumescent white cataract, unbelievable. Another one is a case with loose zonular support. If you try to do a manual capsulorhexis, you see the whole lens capsule shifting. Or you know the ominous sign when you poke in with your forceps to start that manual rhexis and you see wrinkling or loose capsular bag tissue. Well, in a case with the Zepto, it's just no consequence. It's easy. It's as easy as a routine case. Put the device in the eye, achieve suction. Again, in 4 milliseconds, you've got a perfectly centered, stable capsular opening of the size that you desire, whether it's 5 or 5.5 millimeters. So it really takes those tough cases and makes them a lot less stressful for the surgeon with a higher margin of safety. So a lot of times for premium lens cases, if you have a smaller pupil, how do you achieve that perfect capsulorhexis or capsular opening? Are you going to put in a fixation ring or a pupil expansion ring? Are you going to put an iris hook to do all this? It's kind of very traumatic. Or you could do a device like the ZEPTOLink where you can actually place it slightly under the iris. And even if you have only, let's say, a 4.5 millimeter pupil, you can still create a perfectly round, secure, and centered 5 or 5.5 millimeter capsulotomy using the ZEPTOLink device. So in a case like that, it ensures that I get that great capsulorhexis or capsular opening, even if I don't have a direct visualization of it. Now, a big advantage of the ZEPTOLink is that it integrates with your phaco machine. And any phaco machine, it's agnostic. From any manufacturer, you can integrate this device with no extra footprint in your operating room to your phaco machine. And you can use that phaco machine to create the suction that you're using to hold the ZEPTOLink device on the anterior lens capsule. Now, this is great for efficiency because unlike a femtosecond laser, where you have to go to a separate room and use a separate device, then bring the patient in the operating room and then perform the surgery, it can all be integrated. So it's much faster, it's totally seamless, and it really works well with the flow of the operating room. So using ZEPTOLink, I can do cases at my absolute normal speed with no slowing down.